So the coronavirus is making its rounds pretty much everywhere, including spots that give even Plague Inc. players problems. And I'm sure the sane among us have seen the CDC's recommended actions, or at least I sure as hope so. And if not, stop the video and click the link in the description right now. Now, I hate making strategy guides based around life because that game sucks, even if the graphics are great and the minigames can be fantastic. Besides, normally when it comes to making guides, I sit back and let other people make them. But sometimes, like with Fusion Genesis or Odin Sphere, not that many people show up. And while I'm no doctor, I do know the importance of not just game strats, but understanding why something works the way it does. So allow me to share one of my own personal strategies I've come up with to help combat the coronavirus, as well as insights as to why certain strategies need to be employed. First and foremost, to the young among us, don't be idiots. Even if you weren't susceptible to the virus, you can still transmit it to others, so listen to this guide. Yes, the odds of death go down the younger you are, but only those under the age of 10 seem to be young enough to avoid death on a consistent basis. So the next time you feel invincible and say to yourself, I'm gonna go out, I'm not gonna die of coronavirus, remember this line from Mass Effect 1, which I believe went, how confident are you in that statement? 90th percentile? Is a 10% chance of death acceptable? The odds aren't actually that high, but the point still stands. And again, you're not just risking your own health, so don't be an ass. Next, if you see other strategy guides around, regardless of any other factors, if they contradict something the CDC guide talks about, do not listen. The CDC are the ones who look into the game's code and shape the meta. Non-medical professionals like me, we just look to innovate and come up with a novel means of working within the bounds of those strategies. Anyone who contradicts them and is not themselves an epidemiologist, virologist, etc. is a goddamn crackpot. Anyway, to the guide. COVID-19 stays on surfaces for a long time, like way too long to not be a concern. So whenever you come into contact with something that gets touched by a lot of people, like doorknobs, handrails, shopping carts, gas pumps, etc., there is a very real threat of coming into contact with the virus. And since we wash our hands way more than our faces, and because the virus can survive long enough before actually entering our systems if we touch our faces before we wash our hands, you can contract the virus. Hence why the CDC doesn't want you touching your face. But not touching your face and keeping track of every surface you touch isn't easy to do, right? So what's a poor squishy human to do? Simple. Ease yourself into the process by assigning each hand to specific surface types. For example, if you're right-handed, place your right hand over your opposite shoulder, or left nip like you're looking to cop a feel, and use your left hand to interact with doorknobs and the like. This way, if you absentmindedly scratch your nose or something, it will likely be with your dominant hand, since it's closer to your face anyway. This has the added benefit of keeping your elbow and shoulder closer to your face to cough or sneeze into. Why does the CDC recommend this, you ask? Simple. The closer your hands are to your face, the more likely you are to touch your face and contract something like COVID-19. Whereas coughing into the inside of your elbow or shoulder still protects others without putting yourself at risk. If you're not keen on the idea of driving with only one hand, get some masking tape or paper and scotch tape and some markers. Color the tape/paper with different colors and put little strips on parts of the steering wheel that are/are not safe to touch with certain hands, like green for safe and red for dirty. Having said all this, the CDC also advises cleaning frequently touched surfaces around your home as well, including aforementioned steering wheels and car door handles, and for good reason. Remember, letting one hand touch surfaces that could have something dangerous on them is just a stopgap until you find the opportunity to wash your hands again, not a substitute. This is also where this trick shines. You can be safe knowing that only one hand comes into contact with the more dangerous stuff, and when you reach with your dominant hand for soap or to turn on the water, you'll know that you won't undo that effort when reaching to turn the water off again because it didn't come into contact with the hand you were using to touch more sketchy surfaces. Then you can go about disinfecting doorknobs, handles, buttons on microwaves, washing machines, dishwashers, toilet handles, etc. without worry. Also keep in mind, not coronavirus does not mean not a concern. Contracting any other virus will have your immune system busy while it tries to fight it off. leaving you in a much more vulnerable state if you contract the coronavirus later. Hence why we need to be mindful of our health in relation to contagions in general, and not just because the coronavirus is out and about. On the subject of social distancing, this is one field where I actually am an unequivocal expert. So sit back and listen to the master. First of all, don't take the concept metaphorically. Just because someone doesn't show signs of being sick doesn't mean that they can't transmit a virus. Remember, whether an asymptomatic host or just someone who's really bad at washing their hands, you can still contract the virus from just about anyone. So keep a healthy distance, as mentioned in the CDC's guide. Costumes and other wacky outfits and accessories can also be a great tool, as they can lead to others commenting on your attire and starting conversations for those who go crazy in isolation and want someone to talk to when they run errands, or my personal favorite scenario, make you look batshit bonkers so that no one will want to be around you longer than they have to and end interactions with you as soon as possible. Just remember 4 things. 1. Keep in mind the previous advice and keep your damn distance regardless. If you have to raise your voice a little like you're doing a class presentation for a book report or something, you're doing it right. 2. Whack jobs are buying guns and stocking up on ammo, so don't dress up like a complete psycho, and do not wear a mask unless it's a medical face mask. And even then, don't do it unless you're a cheap bastard like me and kept one from a previous hospital visit. Hospital staff need those damn masks to ensure that they and others don't spread the disease in hospitals. So do not buy up and hoard masks. 3. Leave the more revealing clothing such as sexy costumes, togas, etc. to the attractive people. We must resign ourselves strictly to more modest attire and double strap Animal House style togas. The exception to this rule, of course, is if we are intending to avoid human interaction as much as possible, in which case, let that unflattering flab fly all you want. Lastly, remember the importance of practicality. Stay warm/cool and comfortable as needed. Don't wear anything that will make movement more difficult, and if you wear gloves as part of a costume, remember that just because they touch surfaces like doorknobs and stuff instead of you, doesn't mean they're safe. Wash them and your hands afterwards. Or just don't use gloves at all. Wash your hands like normal and continue dividing what surfaces your hands come into contact with to make the risk of touching your face as minimal as possible. P.S. Sorry about the crappy mic. I got a better one, but I didn't have the equipment necessary to make it work apparently. Stay isolated, people.